are deciding maybe they're over COVID-19, or statistically, since they're less likely to die from it, that they can now violate some of the public orders that we have to get together in big groups, or just done with the physical distancing and wearing of masks. As I've always said from the beginning of this, each of us can be lifesavers. But the flip side of this is each one of us can be killers too. Folks that are spreading infection even if it doesn't affect you. And it's important to remember, we have lost the lives of people who are 18 to 40 years old from this coronavirus. From COVID-19, we see it does not discriminate, though we've learned just how much it does discriminate once people are infected. We need to make sure we continue to get tested, and it remains critical that people in every age group practice the vigilance and the personal responsibility of our fight against this. It's an honor system. We can do things to educate, to encourage, and yes, even sometimes enforce, but we'll never have the resources to do all of those three things for everybody. This relies on each one of us using good judgment, leading with love, and finding the actions that will save lives for the people around us. Our hospitalizations have remained steady. I know there's been a lot of news pieces about this, but now they are going up slightly. We track these numbers so assiduously to make sure that we can see any trends. And across the county today, in our general emergency hospitals, there are 772 beds, including 629 acute care beds and 143 ICU beds available, and an inventory of 1,258 available ventilators. These are still strong numbers. Some of those bed numbers are lower than in the past, but that's also because in hospitals, some of the beds that were surged up have been brought back and put back into other operations and remain available to surge up. Overall, the number of people in the hospital with COVID-19 has increased, now reaching 1,515, which is above the recent averages of about 1,350 to 1,450, but it still is well below our peak of over 1,900 in April. So this data I know can be confusing, but to me it sends a clear message that I want to share with you tonight. While you may be done with COVID, COVID is not done with us. And those numbers are going to be a reflection of lives lost in the future, or lives saved, depending on what I and you, what we do. Right now, we're in a new reality. We're not locked down, but we're not entirely opened up. I've always said we're living in the gray. Even at our quote-unquote worst moment, most restrictive moment, there was plenty that was open. Essential workers were out there. Stores were open for food and hardware. Our construction trades continued. And until we have a vaccine, we probably won't be 100% open, going back to large stadiums to see concerts or sporting events. So we live in this gray right now. And we're in between. It means that some activities and businesses are allowed to open, but they don't have to open. And it doesn't mean that we can avoid taking precautions simply because these places open. It even calls on us to make sure we are exercising those precautions more than before. We know exactly what to do to keep safe. You've heard me say it. You've heard Dr. Ferrer say it. You've heard it from Washington to Los Angeles and around the world. Avoid gatherings. Wash your hands frequently, wear a face covering, and physically distance. Testing has also been a critical tool, a part of our system of keeping you safe. And this is one of the best tools that we have to stop the spread of COVID-19. So as numbers go up, so too must testing. Today, I directed our team to scale testing to meet the immediate heightened demand. As of last week, we're meeting demand, but we found a couple days in which we didn't. So immediately, we are going to be scaling up our testing from 7,700 tests a day to a capacity of 13,700 tests, an increase of 6,000 more tests a day starting tomorrow across our 7 city test sites. And more testing appointments are being added all the time. I also want to remind you that there's testing outside these centers. Testing is now increasingly and almost somewhat universally available through your healthcare providers, at our CVS pharmacies, through some state testing centers. So there should be tests for everyone, but we know a lot of people rely on the city and county testing sites, which is why we want to scale that up immediately. And while the city of Los Angeles does not have a public health department, the Los Angeles County Public Health Department is ours, like it is for 86 of the 88 cities in LA County. We moved very quickly, as you know, as a city, to scale up testing and an infrastructure that didn't discriminate on whether you were a resident of the city of LA or another city in LA County, that didn't ask whether you had symptoms or not, that provided what we needed to make sure that our work in bending the curve was effective. And because we took those actions, we saved lives. Since I last spoke to you, studies showed that across America, early actions taken by cities like Los Angeles saved hundreds of thousands of American lives, even as we mourn those that are lost. Our program here bought time for healthcare providers, for pharmacies, hospitals, and community health centers to set up their own testing, and that's what's happening now. To date, we've spent in the city of Los Angeles $70 million on testing, and we were never meant to be the sole provider of tests. Unlike our state and county partners, we've not received any direct funds from our federal government for this testing, specifically put forward for that. So over time, you will see us transition to be a facilitator of our partnership rather than just a provider of tests, making sure that we play a leading role in ensuring everybody gets tests conveniently and hopefully close to the healthcare providers that you use. But today, we still have a system that not only works, but is expanded for your convenience. So go to coronavirus.lacity.org/testing and sign up if you need a test. I've encouraged you from this podium, if you've been out in protest, get tested. Now, in fact, if you haven't been on the streets for a week or so, it's a perfect time to get that test to see whether there is any impact and any spread from the protests. Testing remains free for everyone, whether you have insurance or whether you don't. And if you have insurance, the website will ask you to provide that information so that we can ask insurance companies to help shoulder this cost, so we don't have to take it out of other critical city programs that provide the human services that you need. By law, this test is free, and no insurance company can charge you any copay, deductible, or a fee for the test. That is the law of the land. Adding your insurance information will also allow us to continue offering tests and keep city resources for other COVID-19 response and recovery efforts, whether it's buying PPE for our hospital workers, whether it's working to house our homeless Angelenos who are at threat of getting COVID-19, or providing childcare to our healthcare providers. It matters that testing is widely available, but it also matters where testing is available, and equity has guided our response. I'm so proud that even before the protests for racial justice, we looked at this through a racial justice lens. At the beginning of this, you'll recall I talked about how we had 8% of the population of LA County was African American, but 16% of the deaths. Today, I'm proud to say that we have brought that number down, cut it by 2/3. It still is disproportionate, and we're not going to rest, but 11% of the deaths now in a county where 8 to 9% of the population is African American are in the Black community. This is the sort of lens we must apply to everything we're doing, so that somebody's color, somebody's zip code, somebody's age, somebody's pre-existing condition doesn't become a death sentence for them. And we're monitoring these racial and ethnic demographics to address disparities, to make sure Los Angeles can lead. And we're working with healthcare providers like Kaiser to connect members to seeking tests to the tests that they need now. So you don't have to always go to a city or county site to get tested. You can go to the doctors that you know, the buildings that you know, the places that you're comfortable getting your health care. And we're continuing to make testing available to vulnerable populations. At skilled nursing facilities, we've completed tests at all of them with our skilled nursing facilities at 135 across LA City, and we know that will save lives of seniors who have been the most vulnerable. We've also done this now at our public housing departments. Yesterday at Pueblo del Rio, one of our housing developments, we announced a new effort with the Housing Authority of Los Angeles, our fire department, and the marvelous volunteers at CORE to deploy mobile COVID-19 testing units to all 15 public housing developments in the city of Los Angeles, delivering free on-site testing to all Angelenos living there, nearly 25,000 residents, many of whom lack access to reliable transportation options to get them to nearby testing sites. This transition is the responsible way to move forward, fiscally, ethically, and medically. It will help us save more lives. In addition, nearly 300 employees of the City of Los Angeles signed up as disaster service workers and are helping our county Department of Public Health do the contact tracing that is our other key weapon in the fight against COVID-19. They will track and talk to people who've been in close contact with those who test positive to limit community spread. So if a member of the contact team reaches out to you, it'll appear on your phone as LA Public Health, and please, please answer. They will leave a message if you don't, and I hope you'll call them back, because that decision will save lives. They're not law enforcement agents. They will never ask for personal information or your immigration status. They will only ask you who you were in contact with, so we can then contact them and make sure that people quarantine so that more people don't get sick and die. That is our responsibility, and I want to thank them for stepping up. People who have worked in other city departments, from our libraries to rec and parks, public works, and others, who are becoming these contact tracers alongside their colleagues at LA County. Testing and contact tracing helps protect all of us at a time when COVID-19 has brought new vulnerability to the lives of so many in our city. Jobs that seemed secure have disappeared almost overnight. Small businesses have found themselves unable to meet payroll, and they wonder if they will survive. Families are being confronted with impossible choices every single day. Last month, I joined with my colleague, Council President Nury Martinez, and a number of city council members. When we came together and looked at our coronavirus relief funds, we decided to put $100 million, the most in the country, we believe, times 4, in a renter relief program to help people meet their rent and to help those mom and pop landlords be able to make sure that their properties don't get seized by the banks. Yesterday, City Council passed that legislation, and today, right here, the proof, I signed it into law. It's one of the proudest things that I've done, and I want to thank Council President Martinez and her colleagues for working together with this administration to ensure that we don't just save lives, we address livelihoods, that we don't see more evictions and people who are lost to this crisis, to the streets of Los Angeles. This program will put up to $2,000 into the hands of our hardest hit households to help with rent over a 2-month period, and it couldn't come at a more important time. Eligible tenants are those whose household income is at or below 80% of the area median income, which is $83,500 for a family of 4. Applications will begin in early July. I'll be sure to announce the day it's available, together with Council President Martinez and others. And there'll be more information to share soon at our city's housing website at hcidla.lacity.org. This action builds on other tenant protections that LA has led with, from ordering a moratorium on COVID-related evictions, freezing rental increases for 80% of our city's rental units, those that are in our rent stabilization ordinance, and working with my council colleagues to prohibit landlords from taking advantage of their tenants and guaranteeing renters a private right of action if emergency protections are violated. We're also looking at legal protections, counsel to be able to help folks when the crisis is over, to make sure nobody winds up on the street in a violation of the law. And we're confronting economic inequality throughout this crisis through a variety of means, including delivering Angelino cards to families that are struggling to make ends meet. If you recall, when I first talked about this, our ambition was to try to get $13 million raised for the Angelino cards. And today we crossed an important milestone. We've now distributed more than $30 million in Angelino cards, more than double the initial ambitions that we had. And I've announced so many of those donors right here, and I want to thank them all, from the $5 donation to the $5 million donation that literally has saved people's lives. We don't have enough time in this briefing to share the stories, but I get videos and letters and notes from people who describe what this has meant to them, to be able to pay off their bills, to meet their rent, to have the most basic things that they need to survive this moment. It hasn't just been help. It has literally been hope for so many. Thank you for your donations. This has been a huge team effort, unprecedented. I want to thank my Deputy Chief of Staff, who has worked on this so strongly, Mary Hodge, all of the folks at HCID LA, our Housing and Community Investment Department, and everybody at our 21 Family Source Centers, Work Source Centers, and Youth Source Centers who have distributed these cards together with the Mayor's Fund. Thank you for your life-changing work. I'd like to also remind everybody that there's something important you can do that will help our city get the resources we need to continue to deliver the services you depend on, and that is completing the 2020 census. We have seen that Los Angeles is always undercounted. If you care about Black lives in this city, make sure you are counted. If you care about immigrants in this city, make sure you are counted. If you want to see our schools funded, our public transportation funded, poverty alleviated, racial justice addressed, these all depend on formulas based on the number of people that fill out the census. And year after year, decade after decade, we leave billions of dollars, not just in Washington, D.C., but redistributed to other parts of the country, our taxpayer money that doesn't come home. A full and accurate census determines also the number of representatives we have in Congress, how much federal money we get for emergencies like this one, our preschool and children's health programs, so much more. But our response rate, unfortunately, is only to date 51%, far behind where we were a decade ago. And I know the stress is going on in your life, but if you're stressed about there not being enough, it's a perfect time to connect these dots and to fill out your census form. I can't say enough, but go to my2020census.gov, and you can fill out the form you received in the mail too, send it back if you don't have internet access, or call in your answers. If you haven't, pick up the phone right after this briefing and call 844-330-2020. Be counted today. And for immigrant Angelenos who are worried, your information is confidential. By law, it cannot be shared with other bureaus, departments, administrations inside the federal government. So it takes about 10 minutes of time, but I guarantee you it will bring thousands of dollars to you directly in making sure that you are counted. So my friends, here's the bottom line. COVID-19 is still serious. It can still make you sick, and it can still kill you or a loved one. The virus has not gone anywhere. It's here, alive and well. It prospers from our divisions. It thrives on our exhaustion. Every time you say, I can get closer than 6 feet, I don't need to wash my hands, I can bend or break that rule, it thrives. But we have so many advantages today that we didn't have when this virus first hit Los Angeles. We know how to live safely, and we have the tools and the knowledge to stay healthy. So I want to impress upon each one of you the role that you have played so beautifully. We've seen people rise up to reclaim their democracy. We've seen people rise up to help save lives. We've seen people rise up to generously give to their neighbors and help them get through this time that they are vulnerable and feeling hopeless. Our personal decisions will change the course of history. How we meet this moment and not miss this moment. Write this chapter, not just through the pain of this time, but also through the promise of it. To not go back to normal, but to reimagine what Los Angeles should be and what America should be in the future. And that's how I know we can do it again, because we've done it so far. It's why we shouldn't feel powerless or helpless. You have a role to directly play. In the face of these unsettling and newly high numbers, our role should be to double down on what we've done and what we've done right. We have everything we need to get through this together. We've got one another. We've got our brilliance. We've got our caring. So as always, wear a face covering. Keep your distance and always stay safe. Stay healthy. And yes, I'm sorry, still, whenever you can, stay at home. Here's to strength to all of you and love to each one of you and justice for all of us in the days ahead. Thank you, Los Angeles. And with that, I'd be happy to take questions.
Mayor Garcetti updating us on the city's response to the coronavirus emergency. He said, you may be done with COVID, but COVID is not done with us. He's encouraging all of us to continue to practice good hygiene, avoid gatherings, wear face coverings. He also mentioned that testing in the city and county of Los Angeles will be increased. Capacity will be increased starting tomorrow with an additional 6,000 more tests being made available per day at the 7 city test sites. More appointments are being added, and he also encouraged people to reach out to their health providers for tests, even a place like CVS now offering them as well.
And we have breaking news right now from Disneyland. They had previously announced that Disneyland was going to be reopening on July 17th, which would have been the 55th anniversary of the park, but that has now been delayed. And they're basically blaming the state of California, the state not issuing theme park reopening guidelines until after July 4th. And the folks at Disneyland say that without having those guidelines, they have no choice but to delay the reopening of the theme parks and the resort hotels until the government can approve their plan for reopening. At this point, no scheduled date for that. However, the downtown Disney district in Anaheim will reopen on July 19th, as Disney had previously announced. Of course, Disney, the parent company of ABC7.
And cast members from the film Stand and Deliver stood by the family of actress Vanessa Marquez today. South Pasadena police shot and killed the actress in 2018. And today the family filed a wrongful death lawsuit.
Eyewitness News reporter Veronica Miracle has more on what the family wants.
Tonight, renewed calls for justice in the officer-involved shooting death of actress Vanessa Marquez. Marquez's mother filing a wrongful death lawsuit against the city of South Pasadena today.
Vanessa!
The actress, best known for her roles in ER and Stand and Deliver, was shot in 2018 by police during a welfare check at her home.
She lived alone. She was 85 pounds, and she was shot in the back. So until this is taken care of, until we address these situations, no one is going to trust the police, you guys, and we need that trust.
Police originally responded to Marquez's home because her landlord was concerned for her well-being. Officers told Marquez they were going to take her to a local hospital to be evaluated. That's when they say she picked up a gun and officers opened fire. It turned out that gun was a replica.
Every time we call for mental health or assistance, black and brown bodies end up dying. And make no mistake, these are tragically intertwining.
Protesters who are demanding police reform in South Pasadena say Marquez is another example of a casualty that could have been avoided.
We are here today in solidarity. We've been here for about 25 days, I'd say, straight, from 12 to 6:30 every day to protest change in South Pasadena.
In South Pasadena, Veronica Miracle, ABC7 Eyewitness News.
City leaders in South Pasadena tell us they have not been served with the lawsuit and have not seen a copy, so they cannot comment.
A legal claim has been filed on behalf of a woman and her 7-year-old daughter who witnessed the fatal shooting of Robert Fuller's half-brother. Teron Boone was shot to death by Los Angeles County Sheriff's deputies 1 week ago in the Kern County community of Rosamond. The attorney for Shalandra Thomas and her daughter claims the authorities never showed they were law enforcement.
Robert Fuller had been lynched or killed a week before, and his brother was in fear of his life when these men show up and surround him. That could have been prevented, and that's what this is about.
Gage's claim against the LA County Sheriff's Department is seeking damages on behalf of Thomas, who was hit in the chest by a bullet fragment, and her daughter.
2 years ago, 19-year-old Blaze Bernstein was brutally murdered at a community park in Orange County. His murder was called a hate crime. Now the Bernstein family is fighting hate with love and kindness through the Blaze It Forward organization. Our colleague Ellen Leva shows you how.
When these rocks started to come to us from all over the world, I felt like we weren't alone.
Gideon and Jeannie Bernstein placed symbolic historical rocks from Israel at a memorial created for their son, Blaze Bernstein.
His life mattered. It mattered that somebody who was such a bright light could be taken from us in a moment of hate. It mattered to the world.
The 19-year-old Ivy League student loved cooking, science, and his family. 2 years ago, Blaze was brutally murdered here at Borrego Park in the foothill community of Orange County. He was gay and Jewish. His parents believe hate and homophobia killed him. So, with the community's help, they created a memorial where love could win.